Director of Public Health for Central East and Cheshire Primary Care Trust and Cheshire East Council. Today we're just reflecting on the outcomes really of today's Living Well in Cheshire East conference, which I'll put that question to you. How do you feel? What were your thoughts on today's conference?
Immediate thoughts. It was a very exciting event. I thought it went really well and introduced a very wide audience to some quite new concepts about how to work, and challenged quite a few of ours, and including my own, thinking about how we're going to approach addressing inequalities in a different way in the future, and particularly engaging with the public.
I think we had a good range of partners attending today who would not normally sit in the same room around this topic, and they've come into contact for other reasons, but hopefully we can get them steered in one direction to travel, address health inequalities. Over the next 6 to 12 months, what are some of the key things you think we can look to do as a partnership?
I think it's like everything else. First of all, realise and build on today, and realise we have got a unique set of circumstances in Cheshire East around health, which we need to look at more carefully, think of a different way of approaching, and recognise that the time is ripe to do that, and work alongside the organisational changes that actually are happening with us and for us. That combined with the financial imperative is a time indeed that we've absolutely got to address inequalities to make sure we're delivering and providing cost-effective, efficient solutions and reducing inequalities at the same time. The two have to run hand in hand. There's an economic imperative and there's a moral imperative. I think there's something about setting up the structures well, so that we do have the task and finish group, people who will sign the statement, sign the commitment in the Living Well in Cheshire East call to action. Those people who are prepared to be called to action and sign the statement, take part in a task and finish group that delivers some tangible actions and difference on the ground in those very many areas where there are inequalities. And I think it's about engaging, and we've got many assets. We talked a lot today about assets. Cheshire has many assets, many more than many other places, engaging with those assets, both individual assets and corporate assets, to make a change, so that we are working with our GPs, our hospitals, our local members and our local population to deliver that change.
As a sort of one line, as a snapshot, what would you say would be the message that you'd want people to take away from today's conference, or the topic of inequalities in general?
Yeah, I think it is, we've absolutely been doing okay to date, but we've got a long way to go. Working together is the only way we're going to achieve and make a really big difference, and getting our population, and I think the phrase from today was, as fit as they could be and as well as they could be, will be the key to success.
Thank you very much.
So, Jed, you've seen the presentations this morning, and as the Managing Director of Cheshire East Community Health, how do you feel that the Community Health Service can have the biggest impact on addressing health inequalities?
Yeah, I think Community Services has got an absolutely pivotal role in delivering the agenda around health inequality. Our services, currently work across the whole of the patch in places like, the West End of Crewe, in Prestbury, contrasting areas in terms of health inequalities, and lots of our services, not just some of the public health orientated services like school nursing and health visiting, but other services like district nursing that can give that health promoting message around things like smoking cessation
and beyond. But there's also something around, for me, what I picked up this morning was, we know what the issues are, it's understanding the needs behind behaviour. So, your people out there every day on the front line, integrated within our community. So how then can we use that to start to begin to understand the needs behind behaviour, why people choose to do what they choose to do?
I think you're right, there's a vast amount of knowledge out there. I mean, we've got 1,600 staff, a lot of who are working out in clinics, going into people's homes, going into communities, into local communities, places like children's centres, and absolutely those members of staff will have a clear view about what some of the fundamental reasons are for some of those health challenges that we're trying to get people to meet. And we do need to find ways of collating that intelligence. We're not good at that. We need to get better at it.
And obviously with 1,600 staff, they belong to those communities as well. So there's a real opportunity for us there to actually work with our staff as well. Brilliant. Thanks very much. So Val, as the Deputy Chief Executive of East Cheshire Trust, how did you enjoy the presentations this morning?
Well, I did. I've been working in that service for 30 years, and when I first started, the Black Report was published, and that said exactly what we heard this morning. So I think what I would like to see us all challenged to do, given that we now know the context we're working in, is to come back in 6 months and say, how are we either looking at now, because I do believe there are some good practices in the Cheshire area, and if not, how are we going to? The hospital has got a huge contribution to make in 2 ways. We're an employer of 2,000 staff, and all those staff are real people who have real challenges in their own health. And if we make sure that we're looking after them and working with them to keep themselves healthy, then they're going to be much better health promoters when they're providing services. We've recently signed up to contributing to the Regional Social Value Foundation, and we believe we've got facilities available to the community that will really contribute to their well-being.
Excellent. Thank you very much.